Hi everybody, I'm Michael Uriarty or Dr. Mike, and welcome to Technique Talk, the MYK System, and more. This is episode 21 of our series of comparing and contrasting other techniques with the MYK System. Today, we're going to talk about cupping. If you want more information on either technique, I have the website links in the description below. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. All right, let's do a quick overview. I looked up on who developed cupping, and I can't find anything. It actually says the specific origin of cupping therapy is not known. And so it does, however, say that suction has been a part of therapeutic efforts throughout history. Oh man, I was just about to get a whole bunch of guys gonna put a copy on this and be like, honey, he's a doctor. We gotta, okay. All right. So anyway, suction has been a part of therapeutic efforts throughout human history. So what does cupping kind of do? And you see it a lot of times right now, like swimming is the big sport that I see it in. I don't know that I necessarily see it, probably because people wear clothes in other sports. But in swimming, you know, they're just wearing the little swimsuits. And so you see all the little circles and stuff all over them. And so what they say, and I got this information from the ICTA, and I know I have a name for that, the International Cupping. Hold on, I got it. Here it is, the International Cupping Therapy Association. Oh, I was so close. I didn't say therapy. All right. So, International Cupping Therapy Association website, and they say that they are the global authority in modern and traditional cupping therapy. So I thought that's a good source to go to if they're the modern authority of this. So it says some of the key principles, and so I'm going to bounce back and forth on the notes that I have here from their website. But it creates tissue decompression, which stimulates healing. It releases pain-causing factors. I personally would want a little bit more information on that as far as what they mean, but that's nice. It increases blood flow and lymphatic flow, so that's going to, lymphatic flow kind of is the trash system. It kind of throws everything in and gets things out of the body, and so it draws out stagnant blood, toxins, and dead cellular debris. Stagnant blood, that kind of verbiage reminds me of acupuncture. So, and I'm sure that this is from that time frame, because acupuncture has been around for however long. Another area, it says that cupping stimulates healing through suction on an area of skin, promoting relaxation and releasing pain-causing factors. And again, that's all it says. It can reduce muscular tension and inflammation, increases blood flow and lymphatic flow. It draws out stagnant blood and toxins. Okay, so I got that part. So that's kind of what it does. So some of the benefits of cupping: it reduces muscular tension and inflammation. It helps with chronic pain, myofascial release. Oh, digestive issues. I did not know that. So that's new for me. Fatigue, sciatica, fibromyalgia, as well as mental health issues such as anxiety and depression. Wow. I got to tell you, this suction thing is pretty good. It may provide practitioners with increased comfort and physical longevity, thus extending the longevity of the therapist's career. Oh, well, extending the longevity of the therapist's career because they get to just put that little suction cup on. If you've never had it done, I've had it done. So they put that little suction cup on and then they go, and then it sucks the skin up on there, and then they just let it sit. And the longer it sits, then that's where you get that little circle and the blood, it's all sucked up in there. And then the theory behind it, I believe, is, they take that part off, but you've brought all that blood into that area, and then it, the body has to come and kind of get that blood out and all of that. And so it kind of helps clean up that area and fix that area. That's about what I know from it, So so that's kind of the some of the benefits of it. I'm trying to see key principles. So a number of healthcare specialties. So manual therapist, massage therapist. I know a lot of massage therapists that do this. Definitely used in acupuncture. They use it in sports therapy, PT, chiropractic, things like that. You can use it as a deep tissue massage, and that's where I say, because they put that little thing on and then it sucks the air out of the cup, basically, and so if it's on there and it sucks the air out of the cup, I'll do it this way. Then it goes, and your skin goes up in that cup there. So so used for deep tissue, things like that. Where was I? I was lost. I had it. But anyway, so, orthopedic conditions. I mean, it's naming off some things in here that, sports massage, I get, injuries, fibromyalgia, trigger point therapy, traumatic injuries, chronic conditions, detoxification. Oh, cellulite, scars, stretch marks. Okay. Sports medicine, general relaxation and wellness. It does work, because I've had some issues where, maybe my shoulder hurt or whatever, and they did some cupping on my shoulder, and it did feel better. It did feel better. So that was kind of cool. Now, some of the professions that they treat. So it has massage therapists, PTs, nurses, occupational therapists, athletic trainers. So mainly a lot of the manual therapy professions do this. So that's really good. It's growing acceptance. So there's an increased demand for cupping in various settings, including private practices, clinics, hospitals, professional sports teams, wellness centers, even burn centers. I don't know about that. That would hurt. And VA hospitals. So that's kind of good. All right, so let's go through just a little bit, because I couldn't find out who developed cupping, because it's been around for, centuries, I guess. And so I developed the MYK system, and basically I kind of took my chiropractic education on how can I be as specific as I can with the nervous system, but instead of moving a bone to get into the nervous system, we're going to use the soft tissue. So how can we group the soft tissue and have a specific impact on the nervous system from that standpoint? And so one of the things that I like with the MYK system is we look at posture, because posture is the outward expression of the nervous system. And so if somebody walks in the office and their posture is off, we get to say, hey, something's not right with you. Not with you mentally, but something's not right with your nervous system, because if your nervous system is functioning properly, you're going to stand up straight, you're going to have full range of motion, you're not going to have much pain at all. The more we get off of alignment, then we start having limitations in our movement, and we start having increase in pain. And so, one of the things that I focus on is, hey, let's balance the posture, which means we're going to balance the nervous system. And once the nervous system is balanced, the body starts to function the way it's supposed to function, and you move better, and you're out of pain, and it's really, really quick work. So if we go with some similarities and some differences, so both are holistic from the standpoint of, I say we're trying to get at the root cause of the problem, which is the nervous system. So we're trying to find the specific nerve pathway or the organ that's causing the issue, but treat that organ from a nervous system standpoint. Cupping says they're trying to get to the root cause of pain and dysfunction as well. but it doesn't really explain how. So I don't know how they're doing that. Both of us have a manual therapy focus, so both of them are hands-on techniques. So both train massage therapy, chiropractic, physical therapy, athletic training, occupational therapy. They get in and do a couple other ones as well, like I said earlier. So there was a few other ones that they do. Those are the 5 main that we treat. So continuing education. So our classes are 20 hours, and their classes are 24 hours. Our classes, if you do a live webinar, they're about 600. If you do an in-person, they're about 700. Their classes are about 600 for a 24-hour class. I don't know if that's live webinar or in-person. I'm assuming, I'm going to take it that it's a in-person. So in-person for 600. We're in-person for 700, but you get the manual and the flip chart and the different things with that. So and I think they had a number of different classes. Let me see. Here's their website. So they had more than one. Yeah, there's a series of classes that they have. And okay. That is about the similarities and the differences. Now, things that we treat, I'm not sure that they go after headaches. We go after headaches. We go after migraines. We go after, hormonal headaches. It doesn't matter the type of headache. Personally, I don't care. Carpal tunnel, I would assume that both of us can go after. Rotator cuff issues and frozen shoulder, things like that. Definitely we go after. I think they can go after that as well. Tennis elbow, golfer's elbow, plantar fasciitis, sciatica, shin splints. Those are just some of the number of main conditions that we treat. Some of the other things, and I'm sure that they go after some of those as well. Some of the things that I don't know that cupping can go after, like acid reflux, asthma, things like that, that we get really, really good results with. So I'm not sure if they have that. We have a certification program. I didn't see that they did. I'm sure they do to get into the upper levels of their system. So I will say this, though. I've had cupping done to me, and I liked it. I thought it was really nice. It's not painful at all. It looks painful. If you've never seen the pictures of cupping, you ought to look it up. Sometimes people have just one little thing. Sometimes they'll have like 45 on their back. That looks painful to me, but it's not. It's really not painful. You don't really feel anything. And I got a nice result from it. So if you're having, limited range of motion, if you're having some chronic pain or things like that, I think cupping, it is a nice adjunct. It is a nice thing to maybe go out and see if you could get it done and see if it doesn't help, because you get it done, and like I said, it pulls the skin up and it pulls the blood up, and it kind of holds it there for however long they leave it on, and then when they take it off, the longer they leave it on, the more of a bruise it looks like. But the more of a bruise, the longer the healing. This is how I've been taught. I've never taken the classes, so I could be 100% wrong on this. But the more of a bruise, then the longer the healing process that treatment is going to give you. So that's kind of how I was shown that. So, all right, that's what I got for cupping and the MYK system. There are some similarities, but not really, because we're doing manual therapy, everything on the nerve pathway. Theirs is pretty much like, okay, well, we're going to work the shoulder. They're going to work the shoulder area, or, my low back. They're going to put stuff on your low back. So it's pretty site-specific from that standpoint. So there's a big difference between the two systems, is we're kind of comprehensive. And they're more of a localized, even though I think they say they're more comprehensive, but I don't know how. And again, I would probably have to take a class or two to figure that part out. So if you have information on that and you know that information, put it in the comments and educate me on this. So I would like some more education on this. So the whole reason we did these series, and that we're doing these series, is because I get questions all the time. Hey, is your technique like this technique? Did you take a class and get some of your information from that technique? Because they seem kind of similar and blah, blah, blah. And so, no, I never took a class. I took everything of my information from the anatomy and the physiology books. And so, but But one of the reasons that I'm doing this series is it's kind of fun to learn about the different techniques and to see how are they similar and how are they different. So I would say cupping. This is my opinion now. I'm going to give you my opinion just based off my experience, not necessarily what I'm reading, but from my experience. Because I don't see cupping as a holistic approach to healthcare. I see it as localized to the area that you're having an issue with. And so that's a huge difference between, and that's how I was treated with it. Maybe they should have treated me differently. I don't know. So, but if you have questions or anything on this, so I've got the websites down in the section below. And so if you have any questions or anything, let me know. If you have comments, definitely put them on there. If you haven't subscribed, subscribe to the channel. All right. If you made it this far, smile.